Hi everyone, nice to be here and nice to see everyone here. So my name's Callum. I'm the Risk Information Officer here at Prostate Cancer UK. And along with the specialist nurse support, I run the new Risk Information Service. And I'm the first non-clinical person to work on the support line with the nurses. So I'm just going to give you a quick whistle-stop tour of the service, explain the rationale behind why the service was developed, a bit about my own background, how we've implemented the service. I'll give you a bit of an update on how it's going so far, and then provide some general information on the themes and trends of inquiries, which may be similar to what you experience when you're out in the community. So first things first, if the next slide loads, there we go. What is the Risk Information Service? So the Risk Information Service is a free confidential service which runs alongside the specialist nurse service, and the aim of the service is to provide undiagnosed men with information support related to the PSA blood test and their prostate cancer risk. So the service is being trialled on an initial 12-month pilot period. We're almost approaching 6 months of that. We've got the 6-month review coming up shortly next month. Initially, the service was for undiagnosed and asymptomatic men, but we quickly realised that if we were to rule out all symptomatic men, and as I'm sure you all know, any man over the age of 50 in the UK is likely to experience some kind of lower urinary tract symptom that's more than likely attributed to that benign enlargement of the prostate. So we were missing quite a large group of men that we could potentially be speaking to. So as of January 2025, we have been including incidentally symptomatic men, so men who call the service and they may say, well, I wake up a few times during the night, and I'm happy to speak to those men and just signpost them to the GP exactly the same as the nurses would. So it's still there for men who require that more clinical expertise and input to their symptoms. I would always transfer them through to the nurses anyway, so they're able to have that more clinical input from the nurses and more specialist input. We've got strict boundaries in place that I adhere to, and strict transfer policy. So if I ever feel as though a call or a contact is outside of my remit, I would immediately transfer that caller through to the nurses for their guidance. So we currently offer the following services. So it's a telephone service Monday to Friday, 9 a.m. to 5 p.m. Wednesdays, it's 10 a.m. to 5 p.m., exactly the same as the specialist nurse hours. And I also run an email service and social media responses as well when we post on there. So why do we need the Risk Information Service? So why have we developed the Risk Information Service? So it's estimated that around 7% of the calls received by the specialist nurses each year are from undiagnosed men who are inquiring about the PSA blood test or their prostate cancer risk. And the majority of these callers can have their questions answered by a non-clinical colleague, which is myself, who is appropriately trained on the detail of the prostate cancer risk management program, which Andrew referred to earlier, and the charity's position on risk and PSA testing. So the hope of the service and the aim of the service is to deal with these queries, these inquiries, and then subsequently free up specialist nurse capacity to deal with contacts that demand that clinical expertise, i.e. for men who have been diagnosed or experiencing or considering treatment options, etc. So I won't bore you too much, but a bit about my own background and the training I went through for the role. So I joined the charity in August 2024, and the Risk Information Service was then launched a month later from mid-September. I came straight from the NHS, so I've got about 9 years of experience working within the NHS and private healthcare sector. And I worked in a variety of different roles within the NHS throughout those 9 years. But the vast majority of my time was spent working in operating theatres, specifically urology operating theatres. So I've seen the back end of treatments that men are offered for prostate cancer in the form of surgery. Prior to joining the charity, I had a pretty good understanding of urology as a whole, prostate cancer as a whole, and the treatments that men are offered as well, and medical terminology. So most recently, however, I worked as a uro-oncology support worker, and my role was to support men who had been diagnosed with urological cancers. Primarily, that was prostate cancer due to its prevalence. Provide those men and their loved ones with holistic needs assessments. So the vast majority of patients, like I said, were prostate cancer patients, and I would coordinate appointments for them, chase appointments, give them a bit of an update as to what's going on, because there can be a lot of waiting for those men. It just acts as a bit of a liaison between men and their loved ones and the specialist nurses in the NHS. So when I joined the charity, in terms of my training when I joined, like I said, my understanding of prostate cancer was pretty good, but I had to actively work to switch my brain from talking to men post-diagnosis in the NHS to speaking to men for Prostate Cancer UK way pre-diagnosis, which was a bit of a challenge initially, but I think I'm slowly getting there. I spent the first few weeks meeting with various key stakeholders throughout the charity to get to know the charity a bit better, the work they do. And then I spent several days listening in to the specialist nurse calls to help develop those soft skills on the phone and gain an understanding of what kind of inquiries were coming through to the support line. I also undertook a few mock calls prior to going live on the service and flying solo. So I think about 7 or 8 mock calls with the specialist nurses where they would present me with a scenario and then give me feedback onto how I responded to that scenario. And I also completed a level 1 helpline course to just ensure and reaffirm those soft skills prior to going live on the phone. So after starting with the charity on August the 4th, like I said, the service officially went live on September 18th. And then for the first few days of going live on the service, I had some supervised calls where I would invite a nurse into the call I was receiving so they could give me some guidance throughout if I needed it. But we quickly found out that things were going pretty well, so that they thought their time was best spent elsewhere. So how have we implemented the service? So how can people reach the information service? So we've added a new internal voice recording, which service users and callers will hear when they dial the 0800 number that's on the website and for the specialist nurses. So option 1 is now will now give users the option to come through to the risk information service. They'll hear the following phrase, and it says, if you have questions about your or someone else's risk of prostate cancer or about the PSA test, press 1 to speak to the risk information officer. Option 2 is still for the specialist nurses to go through to them. And also, like I said, I have the ability to transfer callers through that if I think they're outside of my remit. So service users still have the option to go connect to a specialist nurse if their query is outside the remit. And during my absence as well, so for example, I was on annual leave last week, callers can choose to either leave a message on the service and the inbox is monitored by the nurses, or they will be diverted straight through to the specialist nurses. So someone will always respond to those inquiries that are coming in. We've also got 2 new email inboxes set up in place. One for receiving the audio callback requests that come directly from the 0800 number if I'm unavailable, for example, and then one to receive web form submissions from the website. And we've got our own web page, which is a bit of a work in progress, but it's definitely on the website, and it's now directly visible beneath the specialist nurses option. And we've changed all of the signposting around the risk information service, updated the signposting to the risk information service when users are browsing pages like risk factors, PSA blood tests, etc. We've also got some evaluation surveys in place to provide men and their loved ones with the option to leave their feedback, which helps us obviously review the service and develop in the future and see how the pilot is going overall. So that leads me on to how is it going? So how's it going overall? So the target for the risk information service initially, when it was first came to inception, was to average 68 contacts per month, and contacts mean telephone calls, email contacts, social media responses. It's contacts means everything. That's based on the initial 7% proportion of those eligible service users that it was thought a non-clinical person could respond to those inquiries. So far you can see that we've exceeded this target in all but 1 month. I've put February to date in there as well, and we are on track to beat that target as well this month. October and November were particularly busy, and this can be directly attributed to the increase in media activity during those months following the sad news about Sir Chris Hoy. And then we saw a decline in December, which was to be expected, and was a bit of a shock myself, but I was reassured by the specialist nurses and team that they also experienced a drop in December, and they are quite used to getting that drop off in the holiday period in December. So it was good to see that in January the demand picked up naturally, organically. We haven't yet actively promoted the service, although I think we did do a social media post yesterday. I think that was one of our first ones, but we haven't really pushed the service as of yet. But we are planning to do so in the future. So overall, we're seeing about approximate 8% increase, capacity increase for the specialist nurses so far, which means we're performing ever so slightly better than the initial estimate of 7%, ever so slightly. The average call length is around 13 minutes, which is very similar to the specialist nurses. I think they experience calls of around 16 minutes on average. So I thought I'd whiz through a few trends and themes of contacts that I experience on the risk information service on a daily basis, just to see whether they line up with similar inquiries you receive in the community. So The first is access to care issues. So men struggling to get an appointment with their GP, as Andrew touched on, we're well aware of some issues of men getting an appointment at the GP when they want to discuss the PSA blood test or their prostate cancer risk. So, for example, my GP won't give me a PSA blood test. What shall I do? What should those next steps be? We then also, frequent inquiries since the Sir Chris Roy news actually has been inquiries about frequency of testing. So how often should I have a PSA blood test is a common inquiry. And then lastly, family history is a big one. So there's been a sharp rise in these inquiries since the recent media coverage, and younger men are contacting the service. I've definitely noticed that. I think recently I've spoken to men as young as 16 and as old as 99 who have contacted the service. So for questions, for example, my dad had prostate cancer. When should I get tested? So on the next few slides, I'll go through a quick breakdown of how I would respond to those inquiries on the helpline. So the first one, my GP won't give me a PSA blood test. What should I do? So the first thing I tend to say is, like Andrew said, in relation to the prostate cancer risk management program, the PSA test is available free to men who request it. Guidance recommends that GPs should use their clinical judgment to manage those asymptomatic men and those who they consider to be at an increased risk of prostate cancer. We hope in the near future that may change to being proactive, as Andrew touched on earlier, but it's currently reactive. So then I like to check that they have actually spoken to a GP or a practice nurse or a healthcare professional. Sometimes when you delve deeper into these inquiries, it may transpire that they've been refused an appointment by the admin team, or for example, they may have just been told they haven't got an appointment anytime soon, and the only appointment's in a few weeks' time. So I then tend to encourage them to ask their healthcare professional why. So it's okay to ask them why they have been refused a PSA blood test. Sometimes there may be a very good reason as to why that healthcare professional does not think the PSA test is suitable for that man. And then also, I always discuss the advantages, the limitations of the PSA blood test when I've got the service user on the line, just to ensure the service user's got a really clear understanding of the PSA blood test and that it isn't a cancer-specific test. It will never be able to tell a man if he has prostate cancer, but it's a useful tool, a useful test to help identify those men who may benefit from further investigations. And then, like Andrew said earlier, I refer to the Prostate Cancer Risk Management Program. As I said at the start, the PSA test is available free to men who request it. Sometimes those men who have been initially refused a PSA blood test, they find some success from mentioning or referring to the Prostate Cancer Risk Management Program. And sometimes, if it's possible, it can be helpful to speak to another GP practice or nurse if they're really not getting anywhere. And if gents are really struggling, they can then speak to their practice manager to explain their concerns or submit a written complaint. GP surgery should have the information about its complaints procedure either online or by asking the admin team. And then some men find that if they're really not getting anywhere, they can then go through the NHS complaints procedure. It's important to say that as an information and support service, we're not really able to give a solution to this. We can just provide men with the most up-to-date advice, the utmost up-to-date information that's out there, the guidance which is out there, so they can then make those informed decisions about those next steps to take. So I'll move on to the next one, which is frequency of testing, which is a really common query via email and via the telephone service. So how often should I have a PSA blood test? So the first thing to say is that there's no formal guidance in the UK on how often men at an increased risk of prostate cancer should be tested using the PSA blood test. It's because there isn't currently no clear evidence regarding the optimal frequency of testing. So what's recommended by the European Association of Urology is what we call a risk-adapted approach, and that's for all well-informed men aged 50 and over with a life expectancy of greater than 10 to 15 years. So although there's no universal agreement on the optimal frequency, excuse me, some men may choose to request an annual check if they're at particularly high risk or particularly anxious. Some men find that annual check puts their mind at ease, but we tend to suggest as a charity a test every couple of years. Prostate cancer tends to grow very slowly, so I always reassure men of that, and there's currently no evidence to suggest that more frequent testing than annually is overly beneficial. Also, decisions about testing and its frequency should always be made with a medical professional and based on an individual assessment of that person's risk factors, their general health and well-being, the relevance of maybe previous PSA blood tests they've had in the past. But it's important, I always emphasize to men and their loved ones that any new symptoms or changes in urinary habits should never be ignored, regardless of their age, regardless of how often or how recently they've had a PSA blood test, and they should always book in with their GP to have that chat and discuss through those symptoms and changes in urinary habits whenever they arise. So lastly, I think family history. So my dad had prostate cancer. When should I get tested is a common theme. When I receive these inquiries related to family history, it tends to be from men who are under the age of 45. Like I said, I've spoken to men as young as 16, 19 years old. Even today, I spoke to someone who was in their 20s, and as old as 99 recently as well. So as you'll all know, age, family history, and ethnicity are the three main factors that can increase a man's risk of being diagnosed with prostate cancer, and men are 2.5 times more likely to get prostate cancer if their father or brother has had it. That risk may be even greater if they were diagnosed under the age of 60, and there's also some evidence out there to suggest that that risk could be higher if you have more than one close relative, i.e. father, brother, uncle, or grandfather, who has been diagnosed with prostate cancer. So I tend to reassure callers that despite the increased risk associated with family history, cancers aren't typically inherited. And of course, this increased risk is no guarantee of a diagnosis, but it's important to discuss through the risk factors of men to give them that informed choice, to make those informed choices about their healthcare. So I reassure them that prostate cancer is rare in men under the age of 45. We know the most common age for men to be diagnosed with prostate cancer is between 70 and 74, and mention that the PSA test is available free. Refer to the PCRMP again. It's available free to men who request it. And it's important for men to remind their GP or practice nurse of their family history and to discuss the advantages and limitations of the PSA test, which I'll usually do over the phone as well. So we suggest that men who have an increased risk of prostate cancer have these discussions with their GP from the age of 45 onwards. However, like I said, it's important not to ignore any symptoms regardless of age, and always to have that chat with their GP if they have any concerns at all. So that's it for me. I've got some feedback to share just to give you an overall view of how it's going so far. We got some feedback from a recent evaluation we did of the service, and so far it's been overwhelmingly positive. Like I said, we've got feedback surveys in place after the telephone call and after email contacts as well, and men are finding the service very useful. I think about 98% of men said they found the service very useful and their question was answered during the contact. So thanks very much for listening. More than happy to answer any questions related to the risk information service, its inception, how it's going. And the service is available, like I said, on the 0800 number, the same as the nurses, from Monday to Friday, 9 a.m. to 5 p.m. and Wednesday, 10 a.m. to 5 p.m. And more than happy for you to share that information with men and their loved ones when you're out in the community.